Good afternoon, everyone. And today is a public holiday. Thank you for coming to join us. We have a very important topic. Again, we are covering medical legal. Why don't we just let Dr. Amar explain everything. Amar, go ahead.
Thanks, Betty. And please call me Amar. And I'm posting a link to notes inside there. And I'll talk about the notes in a moment. As I said, please call me Amar. And for this session, can I suggest that you ask questions and stop me whenever you like? I have no problems at all with that. I think that will make more sense. But you can always ask questions at the end. Let me share some slides with you. Betty, can you see those slides?
Yes.
Yep. And anybody who doesn't know me, I'm Amar, I'm a pediatrician, Ipoh Mari. Okay, that's probably all you need to know. I work with the Ministry of Health for most of my lifetime. So I'm going to talk about our role, whether you're a healthcare professional of any sort, and application of Child Act in medical practice. But I'm going to go wider than just abuse. I'm going to talk about the whole use of Child Act and all the medical legal problems we face with parents. Okay. Now, I've told you, I've given you a link with notes. There's a QR code here also if you like to scan. And I've got about 12 notes there, different things. The one for this afternoon is number 8, which is medical legal issues in pediatrics, a summary of all that I'm going to say. I've also got number 7, which is a very useful form to use. I think it's one of the most powerful forms in Malaysia. It's a JKM9 form for notification of abuse and of other child protection issues. But I've got a lot of stuff like how to get useful NGOs offering services for free for children, a cyber safety handbook that I wrote, a child sexuality safety training handbook that I wrote, endorsed by all the CSOs in Malaysia, and so on, and of course articles on abuse and stuff like that. All right. And for you who are watching, please don't take any pictures for this session. Normally I don't mind, but because it's a medical legal session, I prefer you not taking pictures. I want to use a word from the Royal College of Pediatrics and Child Health. And they have this statement that they've made many times. As child health professionals, child protection plays a role in everything we do. It's a very interesting statement they made, huh? Everything we do. And I found that true in my work as well. Of course, if you're not a healthcare professional, I think this session will still be useful for you because you know the rights for children and how to intervene for children. So I'm going to talk about our role as protectors, as child protectors. Okay, all of us as medical professionals are child protectors, and we're basically called to be advocates. Quite often we think of advocates and solicitors as people who are lawyers, but no, we are advocates for children. And I also want to mention to you the UN Convention on the Rights of Children. I hope you know that the UNCRC has been around for more than 25 years. We are signatories to it, which means we are bound to the convention itself, and it's a very powerful document. Probably the landmark document for children's rights. And I would if I'm a parent, I make sure my child reads it. And there are child-friendly versions as well. As a parent, as a child, as a professional, whether in medical profession or teaching or anywhere else, I would read this document. So I'm going to cover a couple of different things: abuse, notification of children, custody, parental refusal of medical care, discharge against medical advice, consent, maybe a word or two about divorce, guidelines which are used in Malaysia, which are against the Child Act, which we need to speak about, working with migrant children who seem to have no rights, but actually have good rights in our country, and then working with other agencies and some other issues. And as I said, almost all of this is in the notes. So let's talk about the Child Act first. This is a landmark document in our country. It came out in 1991 and then was revised twice. And in the law, it's very clear that a child is 18. This is a very important thing for you, under 18. Huh? And this comes in line with the UN Conventions of Rights of Children, because all our laws have to follow this convention when it comes to children. So why I'm saying this? Because, some people try and get a 14-year-old married. Some people say a 15-year-old can work, all kind of different things in our country, which are not valid, because under the UN Convention on Rights, which we are signatories to, and under our Child Act, which is our own local act, it's 18, under 18. So keep that in mind when we're dealing with this. Huh? Even the Ministry of Health doesn't know how to use this. And they say by 13, you've got to go to adult wards, which is against the convention as well. Huh? So the implications of the age definition means that MOH services must provide child services from 0 to 17, appropriate child services, appropriate adolescent services, and so on. I want to say the Child Act forms the basis of all our actions. So it came out in 1991. Then the formal sort of revision was 2001. So it's called the Child Act 2001, revised again in 2016, but it's not called the 2016 Act. It's called the 2001, again being revised at the present moment. And some of us, whenever it's being amended, always have a hand in trying to shape it further. So this act forms the basis of all our actions when we are working with children, whether in government or in private or university, okay? Especially Section 17, which I'll discuss with you. In this ACTA, there are many different people described, but for the doctors or medical practitioners in the audience, there are two words for a medical practitioner. One is medical officer, which means you're working in government or university and you have greater powers. If they say a medical practitioner, it means everybody. The ruling applies to everybody, but medical officer applies only to government university. I don't like this distinction. I wish we had used one only. So I have got a summary of the Child Act also in my notes, because I know most of you won't go and look at the Child Act. You can download it, Malay and English version, but I got a one-page summary in the notes, and I forgot to mention that, apologize. So it's there under number 6, Child Act, okay? And I've been using it to teach lots of different people. I summarize it in this format because I know more than one page people won't look at. So under clause 17, they've got this whole bunch of stuff of what the Child Act covers. And they've also got clause 41, where a child can ask for care, another very important clause. So let me blow that up. So these are the areas when we become involved. When a child is abused, we automatically become involved. Huh? At risk of being abused. Notice this, we don't have any evidence yet. We just think the child is at risk of being abused. Already we are involved. Parent or guardian unfit, child neglected or abandoned. This has been put there because of children dying in cars, children dying at home in fires, left without reasonable supervision, requires examination, investigation, or treatment. This is especially put in for us working with people in hospital or clinic settings. Requires examination, investigation, or treatment. Automatically, this ACTA works already. Likely to suffer harm self, parent-child conflict, allowed to beg or illegal. This is put in especially because of religious organizations which put children all over the country. I see them in Perak, at Starbucks or at the petrol station, being put there by religious authorities to beg for the organization. Is illegal, of course. And finally, when a child requests for care from us, we are obliged legally to give care. Now, remember, this is a legal act, okay? It's a mandatory legal act. It's not voluntary. It's not like other acts where, it depends whether people want to press charges against you or not. This is mandatory. It's required by law for us to act. The problem is many medical doctors and medical directors are very poorly aware of their legal responsibilities. Some who know don't want to use it, and that is very dangerous because this ACTA is there and you don't use it, you open yourself to a punishment actually. So what is our role? Whenever a child comes to any of these situations and the child is in front of us, we cannot go to children's homes and rescue them. We can't go to the street and rescue them. But when a child comes to our clinic, when a child comes to casualty, when a child comes to a hospital, then we are required to do this, which is to take into temporary custody. There are 3 people who can act. There's a social welfare officer, JKM, Jabatan Kebajikan Masyarakat, not the hospital social worker. Hospital social worker is powerless under this ACTA, very sadly. But the JKM officer is very powerful and is called the protector. The police officer is also called a temporary protector, and we, the medical officer, are also called temporary protectors. Notice it is not the medical practitioner. So the private don't have this power of temporary custody, okay? So the university or government doctor has the power to take into temporary custody. So when you see a child in that section, let's take abuse, for example, suspected abuse, you must take into care. It's our power. Nobody can remove from our care under the ACTA. It's illegal to remove from our care, all right? So it is the duty of the government university doctors to take into temporary custody. Why temporary? Because the next step will be to go on to notify the protector, and the JKM, Jabatan Kebajikan Masyarakat, will come over and take over the full protector role. We are temporary protectors, all right? So that's the next step, as I mentioned. So one step is to take into custody. The second step is to notify, and we are required by law to notify immediately. Although we say immediately, at 4 o'clock in the morning, no one's going to be working in JKM, so it's the next morning. But weekends, you have to notify. You cannot wait till, the weekend is over. This one applies to everyone. Government, university, or doctors must notify. So if a child came to Betty in private and she suspected that this child comes under the ACTA, whether abuse or one of the other categories, the minimum Betty required to do by law is notify JKM. And she used Borong 9, which is why I've given you a soft copy, a Microsoft Word copy in the link. Because quite often what I do is I fill it on my handphone or computer, attach my digital signature, and I PDF, and then I email straight, or WhatsApp or Telegram to the welfare officer. Okay, so remember that this doesn't apply to pediatrics. It applies to anybody working with children, whether you're obstetrics or in casualty or in eye department or in the medical ward where a 15-year-old is there. Okay, and again, I want to stress the medical social worker has no power. You can't refer to your medical social worker, ask that person to take over. They have no power after. The power is given to you to take statutory custody and notify, both legal requirements. So this is Borong 9. It's very simple, Borong. It's Pegawai Perubatan. I put pediatric there because it's easier. When I was working in the department, we just sign it straight away. But if you look at the form, it's just Pegawai Perubatan and notify. The welfare department, when I talk to them in Putrajaya, they always say, you know, hey, can you write a couple more notes down here, scribble a little bit more about the situation? And we always try and do that for them, give them a more information. So it's mandatory that any child under 18 who is suspected to be abused, at risk of being, or any of the categories you mentioned earlier, is notified to welfare. Okay. So what's the penalty if you don't? The penalty is denda 2 tahun penjara atau 5,000 ringgit. So we can be fined 5,000 ringgit or imprisoned for 2 years or both. No one has had this yet, but Amar has got a bucket list. Amar finished his bucket list before he retired. I'm the kind of guy who, you know, who lives my life to the full. So I've seen the stars in an island off the coast of Tasmania. I've done everything I want to do, but I've got a new bucket list. And this is one of my bucket lists. My bucket list is to catch a doctor who fails a child and then use this ACTA to fix this problem, because too many doctors are ignoring the needs of children. And the law is there to this thing is put in not by me but by someone else to encourage us to notify, because it is a legal requirement to notify. Okay, so be careful. You can be imprisoned or put or fined considerably. This penalty is
especially if Amar gets done his bucket list.
Yeah, I'm looking for a serious one. When somebody failed a child, went home and died, that kind of situation, and then we use this. And I'm hoping to do it to a pediatrician who has failed the child. That's my kind of criteria I'm looking for. This penalty also applies to childcare providers. Any childcare provider like a pengasuh, a teacher, and also family members for that matter, who fail the child also happens. Now, I want you to remember that I'm not talking about abuse alone, all of this. So if you see a child left without reasonable supervision, you require to notify welfare. If you see a child required to beg, you require to notify welfare. Of course, for us, we notify when they come to us. Very hard to notify. But for me, if I see on the street, also, I will notify welfare. I can't go and take the child into custody, but I can notify welfare. Okay, I'll come back to the other things more in detail, but let's talk about abuse a little bit more detail. And I'll use some examples. I thought examples will get the message across more clearly. So let's say you're working in a clinic or casualty or somewhere, and even in private, and you see a 6-year-old child, boy, comes from so-called fall. The parents say there's a fall, and there's a forearm fracture. There are no other injuries. Okay, sorry, examination shows some other bruises. So you get a little bit suspicious. You ask him what happened. You ask the parents to wait outside. It's always good to talk to children with a chaperone, but without the parents, because they tell you things with their parents around. So he says, Daddy hit him, and that's why it happened. So now you have sufficient reason to suspect that this fracture is an abuse fracture, plus you have other bruises. What do you do next? Now you've got to think through what you got to do. If you're in Perak, because I've trained all the pediatricians, you just call one of us. We will take over from you immediately. But most places that doesn't work. Now, calling the police or JKM is a very slow, laborious process. So the best thing is number 2. You escort the child straight to the hospital. And in Perak, you call us up, we will say, come to the ward, bypass casualty. Don't even go to admission room, come straight to the ward. Okay, because that's what we want to do. We want to secure this child. I would say good details on the child, the name, the IC, the address, the phone number of the family. Because in case you say you want to admit and they don't want to admit, they might run away, and then you would have to call JKM to go and pick them up. Okay, so Here, we don't have to tell anybody they're abused. We just say, hey, he's got a fracture. He needs to go to hospital and get admitted. That's all you got to say. And then you escort. You don't send the attendant, you escort. The best is a nurse or a medical assistant or a doctor to go, because somebody who knows what's what, and don't let them run away. Huh? Right? So this is what we would do in this situation. Here's another one, which is a little bit more clear cut. 6-year-old again. Mother noticed panties have blood stains, bruise on inner thigh. When she questioned her own child, she said the father had played in the private parts, so obviously he's been sexually abused, so brings to your clinic. What do? Don't examine. Don't traumatize this child any further. We know there's sufficient evidence from the story that this child has been sexually abused. Again, do number 2, escort straight. In Perak, call us. We will facilitate that admission to the ward immediately. Okay. Once we're in the ward, then we call JKM. Let's go ahead, Betty.
Us means who? Call us means who?
If you're in Perak, call the Ministry of Health Pediatricians.
Okay.
In Taiping or Tolentang or Ipoh or Manjung, they would take over immediately. In fact, Betty, when I was working, I circulated our handphone numbers to everybody.
Yeah.
Because we want people to have access to us and call us day or night so they can admit these kind of children, because we want to rescue these children. Huh? Very important. Again, get good details. In case for some reason the parents run away, we call JKM to go and pick up the child from the house. Huh? All right. So if they run away, then what we do is we fill Borang 9. At this point, you have to don't do anything. You don't have to fill Borang 9 anything. You just say to the mother, hey, this child needs to be in hospital for a proper examination. I need the pediatric team to look after her. That's all we need to do. Okay. Now, what happens if it's the community? This is a bit more tricky. This child hasn't reached you yet. This is a teacher who a 4-year-old girl in a kindergarten complains to her about pain in the private parts. She tells the girl's mother. The mother said, I will look into it. 2 weeks later, same complaint. The teacher is not happy with the mother's reassurance. So she comes to see you and she says, you're maybe a neighbor, a doctor, or maybe she comes to the clinic and say, hey, doctor, what should I do about this situation? Maybe she comes to ask Betty, what should I do? Huh? And so the thing not to do is tell the teacher to ask the mother to bring the child to hospital. That is not to do that. I've always got EMQ kind of situation because there's so many options, isn't it? Huh? The thing to do is number 2, tell the teacher to bring the child to hospital. The Child Act protects the teacher 100%. Nobody can sue the teacher for doing this. So the right thing is for the teacher to bring this child. We already suspect abuse here. There's some risk of being abused here. We bring the child to us and then we move from there. Yeah, the parents will get angry. Yes, sure, but this is the right thing to do, and this teacher is protected. All right. Let's say we choose the first option and say bring to the mother. And now, of course, the mother is chabot lah. She stopped coming to the nursery. What do you do next? The next step is we cannot intervene. We are medical people. We are at the hospital or clinic level. So what we need to do is we need to call JKM. Now, don't ask the teacher to call JKM. Teachers won't know what to do. We are familiar. We know JKM. And in the past, I used to circulate all the JKM handphone numbers routinely. Even now, I've got the handphone numbers of the key JKM people in the country in Putrajaya and in Perak if I need help. And so they will need a formal notification. And so you fill Borang 9. So when you want to call JKM, you fill Borang 9 ready and you send to them, and they are now required by law to go investigate. So they are required to visit the house. Now, what JKM may do to you is they visit the house and say, no signs of abuse. Now, you don't let them do this to you. There are 3 parties in child abuse situation or child protection. There is a police, and what is their job? Their job is to investigate. Then they go to the deputy public prosecutor and say, got enough evidence to proceed or not. And the DPP will decide. Okay, that's the police. For the JKM, Jabatan Kebajikan Masyarakat, what's their role? Their role is child protection. Their role is to make sure the child is protected, go to the courts, settle their placement. Do they go back to the house or do they go to children's home or foster or whatever? Number 3, what's our role? Our role is to make a diagnosis. Has the child been abused or not? JKM cannot go to the house and say no signs of abuse. That laku. That is not their role. They have no expertise to do this. So if JKM says this, what does Amma do next? He tells JKM, you bring the child, please, immediately. I gave you Borang 9 already. I need to see the child. If JKM officer refuse, why do they refuse? Because they're understaffed. They're chronically understaffed. They just cannot cope with the volume. But if they refuse, I just say, I'm going to call your Pengarah Daerah. Ask him why you're not bringing this child. And if a Pengarah Daerah doesn't respond to me, I'm going to call the state Pengarah of JKM. The state Pengarah doesn't respond, I'm going to call the Putrajaya Pengarah of JKM. The Putrajaya Pengarah does not respond, I'm going to call the Minister of Welfare. Minister of Welfare does not respond, I'm going to write something in the press tomorrow. And by the way, I have reached the Minister of Welfare 3 times because
Is
of
your
this
Minister
situation.
of Welfare,
It's a woman's ministry.
Rina?
Right now, yes, correct.
Okay.
So in the past, I have reached like Hannah Yeoh, Deputy Minister. I've reached, other ministers in the past, and they've always been very responsive. There's no need to go to the press. But most times I stop at the state director because state directors are very responsive as well. And they will say, what are you doing? Please send this child straight to the pediatrician for examination. All right.
Is
So
it
don't, yeah, sorry,
understaffed or don't care? Is it understaffed or don't?
understaffed. I can tell you that all of them are chronically burnt out. Imagine one of these officers has got 100 children a year to manage. And that's not just come to hospital, not just bring the hospital, not just pay home visits, not just write reports, not just go to court. Can you imagine that workload? It's an enormous workload. Huh? We need to boost their staffing enormously. So it's easier to close the file, which we should not allow. Let's carry on and look at other situations. Sometimes they can come to casualty and they can be brought in dead or can be collapsed at home. Here's a 4-month-old child brought in dead, collapsed at home, already dead, not able to resuscitate, although we usually will try. Always have a good look at the child. Every brought in dead child, you must examine thoroughly. And one of the things you must do is look in the fundus, and you can see this flame-shaped hemorrhages. Now you know this is a shaken baby syndrome. This is often unintentional, but it's still child abuse. These are parents who can't cope anymore, and they shake their babies violently. They rupture the dural sinuses, and they get a subdural bleed, and it shows up as a fundal hemorrhage. So what you need to do next, the thing you need to do is get a forensic postmortem. Now, I've got this sheet also in the notes. It tells you how to make a diagnosis for children brought in dead. It's something that I've slowly accumulated for myself over years. But one of the things I do, besides looking into the eyes, a final examination, is I do a babygram, or sometimes it's called a full body X-ray. When the baby is dead, we're not worried about radiation. My radiologist has always been very friendly with me, and we quietly take the baby to the department, and we do a full body X-ray. Ask them to have a quick look at X-rays. You can then see fractures. That's another thing. The moment from the fundal examination of the X-rays, we see some sign of abuse, then we stop. We don't do anything more. We ask the forensic people to take over. If we don't see anything here and we haven't got any evidence of abuse, then I do all these things because I'm looking for a cause of death. I can tell you if you do this 50% of the time, you will find a cause of death from my experience. Sugar, by the way, the only reliable place is the eyeball, the vitreous. You have to put back some saline to re-expand the eyeball. One 6-week-old child from Taiping had a sugar of 0. And then when we went back and questioned the mother, she had not fed her child for 12 hours. She, very young mother, inexperienced, don't know what to do. And so again, neglect, child abuse. And although we notified, we actually spent a lot of time educating her, helping her for the next child, so the next child will not die. So many of these things help the next child, which is what we're thinking of. And when I leave you to have a look at that sheet of paper. Remember, this is not a post-mortem. These are clinical samples, limited clinical samples that help you make a diagnosis. I started doing this in about 1988. I was in Sarawak, working alone largely. And a lot of these things help me reach a diagnosis. And parents are happy with me doing this because I can avoid a full postmortem. I will tell them, hey, I need a postmortem because I don't know the cause of death. They say, doctor, can you avoid? Then I make sure there's no obvious abuse. Then I go and do the rest looking for a cause. Okay, I'm going to move on. Well, I want to say some points about abuse for those of you who don't know abuse very well. We are confused in our country with the legal system. We think this girl who's been whipped by her mother is not abuse. But this 2-year-old who's been punched in the face is abuse. But under the Child Act, both of these are child abuse. The definitions of child abuse, physical, sexual, emotional neglect are in the resource notes I've given you. And under the Child Act, physical abuse is sustainable, observable injury, non-accidental application. So you hit a child or threw a child, something a child, or throw a child somewhere. So for example, if I slap a child, and then for the next 12 hours, there is an observable, sustainable injury in my finger marks, that is child abuse. So similarly, a cane mark like this, which is an observable, sustainable injury, is child abuse. This will include X-rays or ultrasounds that show internal body injuries like a fracture or a hematoma, stuff like that. Sexual abuse, notice there's no definition of penetration. It talks about one person using another person for their sexual gratification. It's a very good definition because it covers everything from exposing yourself to the child, to porn, to Of course, anal, vaginal, or oral penetration, boys or girls. Emotional abuse, again, that word, sustainable, observable impairment of the child's mental, emotional functioning. A little bit harder to diagnose for the younger children, but there for the bigger children. And for neglect, we look at the severe one, food, clothing, shelter, and stuff, and education and stuff like that. Okay, so this is definition. Remember that most parents don't know this, and 25% of our children are physically abused because they're being hit right now. I showed this the last time I talked about abuse, and I want to say that this is a graph that shows our numbers, and I haven't put in the latest numbers because they're unreliable. But I want to say that even these numbers are unreliable because we tend to report under 12 to welfare because we got this mindset from MOH that under 12 is children. We don't report 16 to 18 that come to casualty because we call it rape. And then 12 to 15, some people report, some don't report. So we fail to report a lot of these children to welfare department. So we must not classify sexual abuse as rape. Sexual abuse and rape are two different symptomology. Okay, rape is something that happens largely to an adult, might happen to an older teen. It's an act of violence. It's usually brief. There may be death, but quite often it's a violent act. Sexual abuse is something that happens repetitively to a child. It's a 12-year-old girl who's been sexually abused 500 times before you find out. It's a 5-year-old child who's been sexually abused 50 times before you find out. Okay, so you cannot imagine the symptomology of sexual abuse. It's huge. I think sexual abuse is a more horrible word than rape. Rape is a horrible word as it is already. The media likes to use the word rape because it's very emotive, and sexual abuse doesn't sound emotive enough. But I want you to tell you that when you diagnose sexual abuse, you tend to report to welfare. And then this number will jump immediately up by another 1,000 plus because we're not reporting them. Huh? If you don't report to welfare, protection does not happen for that child, which is the important thing I'm trying to get across here. So I've done a couple of studies. So other people, Kamarin Chu and Ahmad, and we look community studies looking at it. And this is the figures I want to remember. 1 in 4 children are physically abused. So if you look around you, you're working, you see 4 children, 1 is being physically abused. And 1 in 10 children at least is being sexually abused. For every 10 children that come to your clinic, to your ward, to your setting, or to, if you see in Aeon or a teacher in a classroom, 1 in 10 are sexually abused. So we're missing the majority, and we need to be very, very aware and ready and suspicious. As I teach people, sexual and physical abuse are different diagnoses for every pediatric problem that we see. That's our background differential diagnosis all the time. So let's move on. Do we need a police report? I haven't covered this. Let's talk about this. Now, why do we need a police report? We need a police report only for 2 reasons: the legal proceedings and for specimens or pictures that we require for court. Without the police report, those specimens or any pictures taken are not valid. Even our pictures, also the court doesn't accept. They require the policeman to come and take pictures. Okay, so when do we report to the police? All sexual abuse we report, and any severe physical abuse we lodge a report. So if someone slapped their child, we probably won't. But if anybody's got a significant injury, we will report. I want to recommend that you lodge the police report, not the parents. The parents are not required to lodge a police report. And if parents don't lodge a police report, we still require to take action. This is a problem with casualties. Many emergency departments say, oh, I can't see this child until you lodge a police report. It's not true. And some obstetricians will say, so I can't see this teenager until you lodge a police report. No, it is not true. The law requires us to act. The Child Act requires us to act. Okay, so we don't need a police report by the parents. Let me give an example so you understand what happens quite often. 14-year-old brought to the ED by a mother for alleged sexual abuse. The mother has lodged a police report. She says it's the husband who's done it, is the perpetrator. Now he turns up, he finds out about it, and then he has a heated argument with his wife, threatens her life, and she withdraws the police report. And what will happen is, casualty ONG say, okay, tak boleh buat apa-apa sekarang. No, it's not true. The Child Act requires us to immediately take the child into custody. So what do? We don't let them leave. We take them temporary custody. We, of course, notify the welfare department with the Borang 9, and we lodge a police report. And I want to recommend at this time, you do a simple 1-line police report. I suspect so-and-so has been sexually abused, full stop. The police will pressure you to write more. They cannot. Okay, why do you want a simple report? Because they will come and see the pediatrician in the ward, and they will take a more detailed story from us if our information and yours conflict is thrown out of court of law. Having said that, can I say that less than 5% of all sexual abuse in Malaysia reach the courts because it's a mess right now. We're having difficulty with evidence. So let's try and do this. So remember, this is what we should do. No, but we are required to take this child into custody, and we need the police report for the police to come in and take start investigating, and of course we want to take samples. And any questions at this point about abuse before I move on to wider protection issues?
I think the main problem is also the people who are handling it. Even me listening to just your lecture, I get so disturbed by it. Can you imagine if I have to go and make a police report and then take the child into custody?
Yep.
And these are all not yet confirmed, yeah? It is alleged, right?
Right. Agreed.
Yeah.
But notice the Child Act requires us to act even when it is at risk. Notice, at risk, not even suspected.
Right.
Okay. Yeah.
So so we take some questions now. First, Dr. Hafiz asked if JKM is closed on weekend or public holiday, who do we contact?
Actually, they are not actually closed. If you see, what you need to do is build a relationship with them. In my early days, I struggled, and then I decided I would train them. So I got the state welfare director to allow me to train her officers, and I called down the legal advisor from their own department. And of course, I got the Child Act, which they also have. I run scenarios, and of course, the legal advisor said, must do this, must do this. The Act says this. So then their eyes opened very big. They did not know, because you see, JKM officers are not social workers. They are just university school leavers. Maybe they have BA in business administration or something. They're not social workers. If we had social workers like UK, you don't have to worry, Betty. They would act immediately. Huh? So one of the problems we're having in JKM is not having social workers. So for me, because I train them and I support them, I can call them day or night. And so I suggest that if you're working in the Ministry of Health or even in private, develop a relationship with the JKM officers, get to know a few of them. One is not enough because they may move around, and then offer them support. My support is, hey, your anak is sakit, you come straight away. I will see. I will personally see your anak. If I'm not around, I will get one of my other pediatric colleagues to see. So I support them. And the second thing I support them is I don't make them wait in casualty because they're busy. They can't afford to get this child to admit it through casualty and all that. I say, you just come to our clinic immediately. We will see the child immediately. There's no waiting time. Or you come straight to the ward, we will see for you. So they are very happy with that kind of layanan that we give them. Okay. And I said, you don't worry, if you can't go to the house, I'll get our hospital social worker to go to the house to write a report for you. And don't worry, we will write a report. You don't have to ask for a report. I make it mandatory when I was working that every doctor will write a medical report without being asked. We write it in advance, okay? JKM is just going to say, I need a report, and we furnish it for them. Okay,
just have a brief look at the questions, and do you want to take it now or whether you want to take it at the end?
Let me stop sharing so I can see the questions. Yeah,
it's in the chat.
Yeah, if hospital JKM, so let's not call JYHE. Don't call the hospital JKM. Call them social workers, medical social workers. Okay, so if the hospital medical social workers has no power, who should we call for JKM to take action? So, Jai, you need to know the JKM officers. So if you go to the JKM website, you can easily, in that resources I gave you, there's also a link to the JKM website and stuff like that. So you got to know your own state JKM officers and their numbers, and then, be friendly with them. They'll give you the handphone number, and then you can just text them and call them. Huh? Okay. Of course, they got their own life. They are struggling, so I'm sensitive to them. I say, don't worry, you come tomorrow morning. I just want to inform you first. So first thing in the morning, you come and settle this. Huh? How do we take a child custody, especially when parents are not cooperative? Jai, you have very, very good answer. This is like a Bollywood movie right now. We are pulling on one side, the parents are pulling on the other side. Yes, that is a problem that we have, which is why your hospital security and your Pondok police is very important. If you've got a Pondok police, you are better off. In many hospitals I work, we had police there. So I just inform them to come and help me, and we'll take into custody. If the police say, doktor, ini hal keluarga, biar dia masuk, saya cakap, apa you punya IO? I just call the IO, and IO will say, what are you doing? Admit the child, okay? So usually the IO knows the act, but the junior officer may not. So usually you must prepare to call higher up. If you only got security, hospital security, then no, you may be in trouble. Hospital security may be clueless and blur, and you will have to actually, work well with parents. And I will come to what will happen in a moment. Okay, Jai? I will tell you what to tell parents so that they cannot go home. All right. Any advice for suspected child abuse case in GP setting? Yes, Razo. In the GP setting, what you should do is get very good details for the child. Secondly, Razo, I suggest you have a very good relationship with your nearby hospital pediatricians. The next step I would say is ask the parents to wait out for a moment. You call up your pediatrician and say, I got this problem here right now. And they will say, hey, come and get admitted, I think. With it. So you will tell these parents, hey, I need admission. And if you can, Razo, get one of your clinic nurses to escort them to the ward. If they chabot, then you fill up Borong 9 and send it to JKM to fill. If you're working with me, Razo, I would have done it all for you. I would have called JKM for you immediately, and JKM might even come to your clinic and rescue you. But that's because in Perak, we have a unique relationship with them.
Fiona says that Dr. Jagannathan from Docquity asks, as a GP doctor, how does a GP make a police report? Can we make a police report without the consent of the
Of course, you can make a police report with a police consent. Anybody in Malaysia can make a police report. We don't need the consent of another person to make a police report. And tell Dr. Jaga that he is covered by the Child Act. Nobody can sue you for making a police report, okay, under the Child Act. Even later, it's found out the child is not abused, nobody can sue you. So I think that we don't need the parents' consent. Usually I try and avoid all this, by the way, and I'll tell you in a moment how we can try and avoid this.
I think we go on first.
No, it's okay. Other than Borang 9, Dr. Azlin says, do we need to launch a police report as well for the pregnant 15? Oh, of course, Azlin, a pregnant 15-year-old who's not married is sexually abused, full stop. No matter who made her pregnant, she's sexually abused. And Azlin, maybe I'll take a question here, enlarge a question. There are two different situations for this pregnant 15-year-old. It could be an adult, a 25-year-old man who's taken advantage of her and sexually abused her. Then we want to catch this perpetrator and fix his life. Second possibility is maybe she's in love with another 15-year-old boy and he had sex with her and she had sex with him and she got pregnant. Then there are two people sexually abused her. The 15-year-old girl sexually abused the 15-year-old boy and the 15-year-old boy sexually abused the 15-year-old girl. Must remember that after kanak-kanak, both were sexually abused. So then I'll feel 2 Borang 9s for both the children, have both of them admitted and deal with them. I will deal with them very differently from the adult who sexually abused a girl or a boy. Okay.
Oh, I see.
Okay. Let's carry on like you suggest, and I will answer some of these uncooperative issues that people are talking about.
Yes.
Now, let me go on to this one, which will take into account the uncooperative one, because this is a slightly more difficult one. This is a child who requires examination, investigation, or treatment. So let's say you see a child, he needs to be admitted. You see a child who requires to have a lumbar puncture or something else, or you see a child who needs a particular treatment, but the parents are not keen. All right. Seem to have dirtied my slide, but it doesn't really matter. Okay. Under the Child Act, how to get rid of that?
I also don't know. It's somebody else's work, you know.
Let me get it back again. Okay. I think I did it,
Oh.
All right. Yeah. So under the Child Act, no parent or legal guardian can refuse care for a child. Full stop. That's very clear. So Child Act says when a child requires examination, investigation, treatment, then the Child Act comes into play. And who decides this? You and I decide that. We decide the child requires examination, investigation, treatment. Of course, let's not go for small things. For example, if you want me to treat a child with meningitis, but they refuse an LP, I will treat even without the LP. I can manage. We have managed and we will continue managing. All right. But if I got a child with leukemia who requires staging and the LP is critical for staging, sorry, we need the LP. So we have to weigh the situation. We work with parents. We don't think our parents are the bad people here. We want to work with them. So again, we are empowered to take a child in temporary custody. There is also Section 22, which JKM or police can ask us to hospitalize the child. And again, don't forget, if we don't do this, there's legal risk against us. Now, Ministry of Health has got a circular which says, I refuse treatment or procedure. It's okay for adults. Do not use this for children. It goes against the Child Act. It's very dangerous. Now, if you fill this for a child and use this in the Ministry of Health, you are putting in writing that you have, you're putting in writing that you have gone against the Child Act. Remember, the Child Act is Child Act. This is just a circular. Circular cannot trump a law of Malaysia. So don't use it. I've never used it for children, never allowed it to be used in the department as well. So let's come to this important thing which we need to understand and parents to understand. What are the implications for the parents if we go and use Borang 9, if you call JKM, okay, two things happen to the parents. They lose custody of the child and the parents will get investigated. The temporary custody of the child is lost. The custody of the child goes under the welfare. The parents are no longer custodians of their children, and welfare is required to go to the house and evaluate the other children and the house situation and the parents. And they won't do this alone. They usually turun padang with the police. So can you imagine, you're living in that neighborhood, that suddenly your neighbors see, police come, welfare vehicle come, then you ask you, what's happening? It's very, very embarrassing. So let's see how this will happen in real life. And remember, we're not talking about overt abuse here. We're talking about parents who are not cooperative with us. So, let's say here's every situation I gave you is a real one. Here's a 36-hour of life, a child with severe neonatal jaundice. The serum bilirubin was above the intensive photo. In Ipoh, I ran what is called a jaundice clinic. You can come, on weekends and public holidays. The clinic is always open, office hours at least. And two parents turned up. One was a doctor, both are doctors, one is a specialist. And they wanted to go home after they saw the results. They promised to monitor at home and they promised to sunbathe the child, which we know is useless for jaundice, that the evidence is not for that. So the medical officer requested admission for therapy because the serum bilirubin is above the intensive photo level. The father got very angry and he threatened the staff. So they called me. This is a very good thing if you're working in MOH, call your specialist. I always encourage people because we got more expertise. So what should we do when I come? Should I do nothing? Should I let the parents decide because they're doctors? Should I monitor at home? And I would love to do this. If I had enough phototherapy lines, I will tell the parents, hey, here's phototherapy line. Here's how to use this. You go home. My MO is coming 3 times a day to take SB, bilirubin, okay? And we monitor from that. I'm happy to make it comfortable, but we don't have the access to home phototherapy right now, okay? So then we have other possibilities now. Okay, so for you, I would recommend call the pediatrician. So what do I do in this situation when I arrive? I talk to the parents, and the first thing we always do is we make sure they understand what is the seriousness of this problem. Okay, that this is a serious thing, can cause connectors, can cause deafness and death and so on. When they have understood that and they still want to go home, then I tell them what is going to happen to them. I will tell them, sorry, you have to get admitted right now. If you choose not to get admitted, I have to call welfare department and notify them legally that this is happening. And if they come, they will do 2 things. They will take custody of the child once they're notified. And secondly, they will investigate you, which is not a very pleasant thing. So what did they do? They're very angry with me, but they still got a child admitted. Notice I didn't feel a Borang 9 here. I just told them what's going to happen. Now, we don't get angry with parents. We don't threaten parents. We just calmly and coolly tell them this is what is going to happen because this is required by law in Malaysia. This child requires treatment and we have to put the child in the hospital. Okay. Here's another example. 9-month-old child presents with prolonged seizures, status epilepticus. They refuse admission. They're in casualty. They wanted to go and see a BOMO. What would you do next? Okay. This was actually another state. The pediatrician called me up. He already called JKM. He had called Jabatan Kebajikan Masyarakat. They say, sorry, we're not coming. So he didn't know what to do. He called me. So you know what I would do? I immediately called the Putrajaya JKM officer and said, what is your officer on the ground doing? This child needs admission. Already 30 minutes of status epilepticus, which means in children is already, cerebral edema occurring. So when I called Putrajaya, they also got very upset with the officer. They called the officer. Within 15 minutes in the hospital, rescued the child, admitted. No problems at all. So you see, the system works. We just have to tweak because the law is there to protect these children. What happens if somebody had gone home? What I usually do is if somebody had absconded or gone home, I call JKM and usually we go with them. I send one of my officers with them. We go to the house, explain again why the child needs to be in hospital politely. They refuse, JKM will take them. Sometimes if my medical officer has gone to the house, I ask them to give me a phone call and I talk to the parents on the phone because the way I talk is going to be very different from the way they talk. And sometimes that's sufficient to convince the parents to get admitted. What about discharge against medical advice? In East Malaysia, they call it DAMA, discharge against medical advice. In West Malaysia, we call it at own risk discharge. And, again, MOH has got a circular which says that discharge against your own risk, this thing is not legal. Don't use it for children. It works for yourself, works for adults, okay? But it doesn't work for children. So let's take an example. If you got a 9-month-old child, let's say on intravenous drip, on IV antibiotics, oxygen in the ward, suspected meningitis, GCS 13 out of 15. They want AOR discharge. I find this always happen late at night. It's a young house officer who's got this problem. I tell all house officers and train them, you please call the most senior person around the MO and then call the pediatrician. So they want discharge because they want to see the BOMO. What will we do? What do I normally do? I ask the BOMO to come to the ward. I have no problem. Come lah. So I tell the parents, bring the BOMO to the ward and they can do their thing there, you know. So far, no BOMO has agreed to come, sadly. I don't mind. Do not do number 2. Again, the moment you sign the AWOL discharge, you are legally can be imprisoned for 2 years or, you know, fined $5,000 because you're telling the Child Act you have broken the Child Act. So what you need to do is, what I usually do is I call the security to guard the door, call the police for help, immediately call my JKM officers. 4 o'clock in the morning, a bit tricky to call them. So we just protect the child until they come. We are temporary protectors, and we put them. In private hospital, it's a bit more tricky. They may be able to take the child home. So you will have to actually call JKM or get support from the MOA side. But again, very hard to retain them in a private hospital as compared to a government hospital. Must remember this applies to orthopedic surgeons, physicians, anybody working with children anywhere. If they ask you to move to another hospital, sure, that's possible, but we escort. We cannot let them go themselves. We escort the other side. By the way, this child that I managed would have died if we had sent home. So we salvaged the child. So we just told the father, hey, minta maaf Bapa. After we explained the meningitis and he understood the risk, we say, minta maaf Bapa, jika nak balik sekarang, kita terpaksa panggil JKM dan JKM akan buat 2 benda. Satu, dia akan ambil alih kuasa anak di bawah mereka. Ibu bapa akan hilang kuasa atas anak. Kedua, mereka akan siasat dan mereka akan datang rumah dengan polis untuk siasat. Tak berapa cantik lah semua ini berlaku ya Encik. Lebih bagus kita duduk, biar kita rawat lagi sampai anak sembuh ya. Usually 95% of the time, no borang 9 is filled. We can keep the child. Notice here is not overt abuse. Okay, or just use the Child Act. Please also note that a private clinic, a private hospital cannot turn away ill children. Please remember that. You are required to give treatment. The reverse also happens. They come to you. The least you should do in the clinic is, give them oxygen you have, and you escort them to a hospital. If you're in a private hospital, money doesn't count when a child is very ill. You have to treat the child first until you can transport them somewhere else. Okay. Now, come to authorization of medical treatment. Who can authorize treatment? Again, this will be another contentious issue. And by the way, these notes are available to you. So in Malaysian law, we often taught, by our medical school, when there's no consent, two specialists will meet and decide. No, that's not true for children. I do not know about adults. I think MMC has got some guidance for that. But for children, when the only people who can give consent is the parents or the legal guardian. Again, here, legal guardian, not grandpa, grandma, uncle, auntie, okay? They must be the court-appointed guardian. So when you got a consent problem, either parent can give consent. So if the father and mother, one refuse, one consent is sufficient for us, legally binding. Problem is that, they will end up in a divorce. I don't like this. I prefer parents agreeing, okay? So, but one parent is sufficient. If there is a legal guardian, uncle, auntie, grandpa, who's got a court-appointed legal guardian, they can give consent. But if they are not, uncle, auntie's consent is not laku. Let's say parents are working in Singapore and only grandma is here. Grandma's consent is not legally binding. Okay. So when parents refuse, not available, or abuse is suspect, the only person who can give consent to us is the JKM officer, Jabatan Kebajikan Masyarakat. Okay. They can authorize treatment, including surgery. All right. So let's look at examples. Here's a 2-year-old child that was in a district specialist hospital, required an open reduction for traumatic lower limb fracture. The orthopedic surgeon wanted to go in. The pediatrician also talked to the parents about going in. Both parents refused. So what they did was they called me. I called in these situations, I usually call the state director of welfare, because it's a serious one. We filled Borong 9, gave to state director. She sent the officer down. The officer signed the consent. The child went for surgery. That's what we do in this situation. What about emergency? Here's a 9-year-old child with traumatic chest injury, MVA. I was called to casualty. Nobody around. They're required to do urgent chest tube and follow up with surgery. Parents not present. I think one relative was around, but as we said, that's not legal consent. So I again called the welfare officer, state welfare director. I told her we have no time to even fill a Borong 9. We're urgent. Can we go ahead? She said, you go ahead. I'm coming right now. Personally, I will sign the consent form. So we got the Borang 9 ready for her, and she came and signed the consent form even after we started the surgery. Yeah? So, we go ahead first while we're waiting. But again, you notice we have a very good relationship with our welfare officer. Okay. Notice that in issues like divorce, both parents have a right to information of their children. And unless the court, gives the legal guardianship to one parent, both parents still have legal guardianship of children. Unless one parent is an abuser, then we don't give information. Yeah? Okay. Well, let's skip that for a moment. Yeah, let's cover everything in the question. So I want to tell you that lots of funny laws in our country which are not standardized by age. And for that reason, always remember it's 18. I think it's time to standardize all our laws to 18, including marriage age. One of the problems we face increasingly, especially working in Sabah, but also in the peninsula, is that, you got children who are migrant, whether they are documented or undocumented migrant. Don't use the word illegal, they're not a good word. So documented or undocumented migrants, or stateless children, or in detention. Now, a lot of Treasury and MOH circulars go against the Child Act because they say, these people have to pay money to get treatment. But the Child Act is very clear. The Child Act covers all children in Malaysia, not just Malaysian children. So remember that. The Child Act is very clear. It's not just Malaysian children, it covers any child. From the moment they land in KLIA or cross the border from Singapore, the Child Act covers them. And for that reason, we're required to offer them treatment because the Child Act requires them treatment. There's a lot of confusion on the ground regarding this. So here's a 9-month-old undocumented Indonesian child was brought to my casualty at 4 o'clock in the morning. Very severe pneumonia. They did basic resus, required to actually admitted to the PICU for ventilation. Admission room says need a deposit of 500. Parents no money. So I wonder what you would do next. Let the child die. I admitted the child straight to the PICU with no RN. Okay. I then notified the DG and the deputy DG that I done this and say under the Child Act, we are all liable if we don't admit this child and treat this child. Okay. Right now, I've worked with one of the deputy DGs to change the circulars a bit. You can admit urgent children first, worry about money later. But remember, the Child Act doesn't require these people to pay. We treat without payment. That's what the Child Act says, because it follows the UN rights for children. Let's skip all this. There's issues regarding to vaccine refusal, child marriage, and life-threatening obesity. I like to take that by questions, and let's skip that for a moment. And I just want to say that the Child Act recognizes that the rights of children are not inferior to that of parents, and that parents sometimes make poor decisions, so we need to support the child. Remember that if you're treating the child, that's your primary patient. The parents are secondary. I always want to work with parents, remember that. But your primary patient is the parents. And I love the statement from the UN Convention of Rights. It's not Article 12. I think I got a mistake here, but it's in the UN Convention of Rights of Children. In all actions concerning children, the best interest of the child shall be a primary consideration. Remember, that's a basic tenet in the Child Act. Let's take questions. Okay, yes.
Okay.
I may have missed some questions. Yep.
Firstly, I would like to say that I've shared the link for the nurses to register for ECERT.
Yep.
So you can get the ECERT. I am just trying to think back at whether I did about 2 years of PITS as a house officer and as a medical officer. And I'm just trying to think back, was I ever liable to be? I did not know all this.
I think most people don't know. Universities don't teach them, and their own departments don't act like this adequately. That's why I have that bucket list now, because maybe that's the only way we can move forward. Let me try and take some of the questions. I'm just going to jump in, okay, Betty?
Go ahead.
Okay.
I just want to share the QR code.
Yep. Okay. Okay, I've lost my chat. Okay,
let's see. I'm back. So we have a lot of questions. We have a lot of questions. So we stop at Aslin. And
we finished Aslin. So Jega, I hope I've helped you answer. If the parents are not cooperative. So if they're not cooperative, Jega, for us, we actually get the police to help us. For you, you have to call JKM to help you if you're in private, Jega. Okay. In working in Ministry of Health University is a lot easier. Okay. But don't forget, I often advise parents that you may lose custody of your child. Be very, very careful. don't go down this path. Okay.
How do we deal with all the drama and the child feeling guilty?
We remain calm. And if there's more drama, we get more and more people involved, which means we get JKM officers involved, we get police involved, and so on.
But
I wish we have better quality security,
yeah.
though. Yeah.
The security taking away the parents, and this is all watched by the child. It's
Yeah, but
really-
the security not to take away the parent, take away the child is what we're going to do. And
Oh,
we
it's
try
so-
not to do that because it's traumatic. But don't forget, these children are in need of protection and of care. Okay. Let's look at Lim's question. If a patient is 16-year-old, we think the child needs dialysis and the parents insist on AR discharge, what can we do for that? Can we use Boron 9? Lim, again, you need to decide here, how severe is this thing and what is the implications of it? If I've got a child, I'm going to enlarge your question. If I've got a child who's terminal, we failed chemotherapy, got a brain cancer, spread to the midbrain, there's no hope. Of course, I will facilitate a child to go home, to die comfortably in home. But here you got a child who needs dialysis and is rescuable. And we know that, you can have a long lifespan. Yes, of course, we use Boron 9. The problem will come. What will happen if the parents then refuse to accept this child back? We'll have to find a foster home. There are lots of issues here. And I have worked through those issues with many NGOs and colleagues in the welfare department. I'm prepared to go the distance. Yes, so we will do that, Lim, for life-saving thing. Okay. Chan Fong Sing said, for a less than 18-year-old girl who found pregnant, mother claim will get married. Is this still considered as sexual abuse? Yes, of course it is. Fong Sing, you must recognize that a lot of these situations, the parents are paid. They're in poverty. The abuser will pay them. The big, huge one from Sabah, where the Ministry of Health knew, JKM knew, and the Sharia courts knew, and the police knew, and nobody took action because he paid off the parents and they withdrew their police report and everybody closed case until we found out and we made a stink of it in the newspapers, and then only was reopened. Can you imagine being married to your rapist, to your sexual abuser? We wouldn't want any child to do that. Of course, Fong Sing, it could be that this 17-year-old is in love with another 17-year-old. It's a very different situation then. We still go ahead and report, but we deal with it very differently than the way it's being said there. Okay. 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 Yeah. Let me go on to Fiona from Dr. Hamza. In a case where the parents refuse hospital admission, Betty, if you keep doing that, I keep losing my chat.
Oh, I see. Sorry.
Okay, don't worry because it flipped between the thing. It's okay. Dr. Hamza, in a case where the parents refuse hospital admission or referral for their seriously sick child, does this consider as neglect, and can we as medical officers check? Of course, Hamza, I hope you've heard the rest of my discussion there. This constitutes significant neglect, and the Child Act definitely empowers us to do this. Again, I wish the private was empowered as well as the hospital and university. Government and university are very well empowered. Chan Fong Sing says, if a parent insists to bring a child to private center, not keen for referral to tertiary center, what shall we do, especially at this hospital? Your responsibility, as far as I'm concerned, is to escort this child to the next center. There's a problem, isn't it? But you got to tell parents, sorry, I got to escort, because you're not sure these parents are going. You're worried about this child, okay? Can I tell you that what I usually do is I have one more step. I call up the tertiary center, the private center they want to go to. In my experience, the private center, the moment they hear the voice, hey, this one's going to be a problem. We don't want to accept. Then they tell the parents, sorry, we're not accepting. You better go to the tertiary center. Then the problem is solved for us. Usually we do it that way. We politely call up the other side and explain the situation. But the minimum you should do is escort this child to that center with your ambulance. Okay. Dr. Navin, if we use Child Act to get a child to receive treatment, antibiotics, meningitis, but unfortunately the child suffers complication treatment, what are the medical legal implications for us? Navin, there are none under the Child Act. You are covered by the Child Act for treating them. Okay, the Child Act protects you. I suggest you download a copy and have a look at it and read through this section because it protects you from this. Your job is to treat the child to the best of your ability. Okay, and protect it.
Yes.
Ask this of Ranjan as well. Ranjan is much better versed with law than I am, and it'd be good to get his opinion as well.
Ranjan is not as easy as you. Okay, sometimes he can be moody. So
yeah, okay, that's all right. Okay, fine. Shin Mei Chu, Dr. Shin Mei Chu says, can this refusal for therapy in an NGO scenario be applied to babies in private specialist hospital? Yes, of course, it works. Shin Mei, it doesn't matter government or private, it works. The only issue is that you cannot hold the child back. So you will have to use a JKM. Huh?
Well, in private, we can't hold the child back.
You don't have the legal right for custody. You only have the legal requirement, your mandatory requirement to notify. Huh? So what I would do, Shin Mei Chu, is I would talk to the parents, you know, unless I'm working in private, this my SOP will like this, okay? I would make sure, number one, the parents know the severity of the medical condition and the damage to the child, okay? And I offer them many options. Whatever we can do, treat. I wouldn't offer that, escort them to a government hospital, so no payment and all that kind of stuff. So when they say no, then I would say, I will be required to call JKM. And if I require to call JKM, X, Y, Z will happen. Even if you leave the hospital now, JKM will come to your house, they will take the child and take to a government hospital. You cannot run away from this, okay? Because it will happen. I'm required to do this by law. I tell the parents, actually, I don't want to do this, but the law compels me to do this for the safety of your child, you know? So I try to look like I'm on the parent's side, which I am actually, huh? So that's what I would do. I'd be apologetic with them and say, has to be done. Huh? The third thing, make sure the third thing I do is have a very good relationship with the government pediatrician. And for me, I have turned up in private hospitals a number of times to support my private colleagues because I can come quite quickly compared to JKM. Yes, Betty.
No, I want to ask you, it must be very difficult to convince even we can't even convince the parent of two doctors. One is a specialist for the child.
But don't forget, Betty, they got admitted, huh? They didn't go home. But the fact
that they wanted to.
Yeah,
okay.
Sure.
So why is it so difficult?
I think we have a opinion among our parents. It's a feudal opinion that, you know, the child is their right to do whatever they like with. I always view children as gifts, which we nurture, you know, in our life. As parents, their children are gifts. And some parents do think like that, but many parents do think they have the final say. They don't recognize there is a law in our country to protect their children. Okay? Dr. Haswan said, what happens if parents don't agree for transport? But we still transport the patient, but on the way there's an accident to the transport, and something happens. Now, Haswan, if they refuse for the transport, I will fill a Borang 9 and give JKM first. Then you are legally covered. If you don't fill the Borang 9, your cover is not so good. Okay, once you fill out Borang 9, the JKM officer has received that form. This child is under their protection as well. You're covered by the Child Act fully. So do that in that situation with parents. The second thing I'll do, Haswan, is, as I've been saying, you know, I always work with people. I try to cooperate with people. So have the phone number of a couple of good pediatricians in Ministry of Health that you know who can then talk to the parents on your behalf. Have a couple of JKM officers. Huh? I even, you know, in my own department, I have encouraged a pediatrician from another hospital to come and talk to parents because they are impartial. You know, the parents say we are biased. So I got somebody from somewhere else, from KL, somewhere else, and I have done that. I've gone to Taipei, I've gone to other hospitals, and I'm impartial to the situation. I talk to the parents impartially about the situation. So I think that's what we do for our colleagues. We always support.
Okay, we go to Naveen from Docquity says, what if welfare officer or protector is unwilling to sign consent for urgent treatment? Can the doctor sign instead?
Naveen, we're not covered. So that is why you need to really work. So what I usually do, Naveen, you know my SOP, if the officer refuses, I just go up the food chain. You know, I even had the deputy welfare minister come and visit me and see the situation that I talked about. Twice that happened. Okay, so and of course that means the welfare officers now are in trouble because they're not following the Child Act. Huh? All right, so a lot of JKM officers need training, which is why I started off very early when I was young, training them, working through scenarios. The scenarios I showed you are the kind of scenarios I write and say, what happened about? For example, you know, another scenario which I do with them, abuse situation, child in hospital, father perpetrator, he wants to take his daughter home from the ward. He comes to demand to take his daughter home. Again, the Child Act protects you. The welfare officers can't do anything. I said, no, there is a clause in the Child Act saying we can immediately, the welfare officer can immediately apply to the magistrate to restrain this father from visiting the child and protect the child in the hospital. So the Child Act is very powerful to protect us in many ways. Huh?
So I think the same question as Lim says, if JKM not contactable, can two specialists sign for the operation?
No, does not work.
Okay.
Does not work. Okay, it's JKM.
Okay,
so,
this is a very important
That
question.
is why you must be able to go up the food chain. So for me, I have the phone numbers all the way up. Even today, even though I retired and I'm working with NGOs, I still get called for consultation for this quite a bit by my colleagues. And even by welfare, they will consult me, and I'm happy to suggest things. And I still have their contacts and can do this. I still do this actually for some of my colleagues, but I think each of us should become empowered. Dr. Shi asked,
Yes.
can we identify emotional abuse? How can we identify emotion must be diagnosed by a psychiatrist? No, she is not really necessary to be diagnosed by a psychiatrist. There's no such legal requirement. Of course, a psychiatrist may be good, but most adult psychiatrists may not be conversant working with children. A child psychiatrist would be, a psychologist would be as well, provided they work with children, and a good pediatrician would be as well. I've usually done this for the court. The court has sent me quite a number of children to do this. The toughest was a 2-year-old they sent to me. Oh God, you know, I mean, 2-year-old, very hard to diagnose emotional abuse. A 5-year-old, 6-year-old, no problem. By that time we talk. When we talk, we always talk without parents. Talk initially with parents, then ask parents to wait outside. And then we talk with one chaperone. Always have a chaperone with children. And then we play games, we do art, we chit chat about life, and along the way we talk about what the real things are. Okay, so I've done this. I've written a lot of statements for the court. Okay, Shamini asked, what if a 16-year-old girl bought parents who suspected such abuse, but the child herself refused for further examination? Shamini, that's a painful one. You know, we don't want to traumatize the child. Let's enlarge your question. We have some parents who come just want to verify. The child maybe ran away for 2-3 days or went away somewhere and came back, and they want to verify that there's no abuse. I don't like that one. Second situation, you know, I want to trust my children. But here, the parents suspected abuse already, so covered by the Akta Kanak-Kanak. We will have to launch they can launch or we can launch a police report. We will notify police and welfare, and we will examine this child. We will present the child. If the child refuses examination, the worst case scenario will do under anesthesia, but I don't like to do this without their cooperation. But we will, because, you know, she is a minor. Betty, I didn't do all my slides, but in my slide, I have a section where I talk about adolescent rights. And we must grow adolescent rights. I've talked to KKM recently. I gave a talk with the Medical Legal Society of Malaysia, also talking that this is a frontier that is very poor in Malaysia. We haven't grown adolescent rights, and I would like to see adolescent rights enshrined in law to give them some amount of rights.
Bucket list. Okay, wait, can I stop you here and say?
No, my bucket list are very severe things. Yes.
We are actually different. I mean, as in women and girls, okay, from, let's say, my mother's generation.
Yep.
And sex has become very predominant feature in many children's life, as in 16 and above. Okay, so I think that maybe consent age should come down to maybe 16 years old.
The consent age is 16 in the Penal Code, but in the Child Act is 18. Don't forget that. These two laws conflict. Okay, so but the Child Act will you know, is the definitive act for children. Can I say that we need to change? And I like the UK Gillick competency issue that they fought over. I think if you need to read anything, read the Gillick. I can't spell this because I'm dyslexic. G-L-I-C-K, I think. Gillick competency. It's a GP who gave oral contraceptives to a teenager, and the parents sued him. He won in court because he said the child is competent enough to know that she needed oral contraceptives, and I need to tell the parents. So I think that we need to work through these issues in our country. Don't have a religious opinion about this. Have a social opinion and a rights opinion for the children. But let me carry some more important questions here. Razo says, when a parent disciplines a child, at what level do we consider the child abuse? Razo, messy, you know. 25% of you who are listening in have been physically abused. Okay, I mean, it happens to all of us. I was severely beaten by my father. I came home in Standard 1. School was extremely boring. I already could read and write, and they were teaching me ABC. I tore up all my books. I said, I'm not going back to a stupid place. My father is a teacher, the teacher's trainer. He took out the rotan. He caned me to bits. I still have a scar from today. Of course, he abused me. Okay, there was no Child Act in those days. So I think observable, sustainable injury. Again, Razo, we work with the children and the parents. If this is a repetitive event, then parents need help. If this is an isolated event, we are a bit more, you know, generous with them. But we still follow them up and see them. Okay. For parents that refuse, Sukana says, for parents that refuse an operation or treatment after intervention by JKM, and receiving the national treatment, when will the parents get the custody back? The parents get custody back when they go to court, and the JKM officers, they say they're fit parents, and the court then will get it. The parents, of course, have under the Child Act the ability to go to court and contest all this. Okay, so it's possible. Yeah, but sometimes parents don't get their children back and end up in children's homes. Okay, children's homes are full, by the way. All the JKM children's homes are full of children. Okay. Fiona, we can continue with questions if Betty is prepared to continue with questions.
Yeah, we can continue with questions, but if Dr. Kwiti have to stop airing it, it's also fine with us.
Okay.
But we will continue with questions in the Zoom.
Okay.
Yeah?
Lim says, so if we really can't get the JKM and we don't do anything, we will lose the kid. What alternative is there? We're doing more harm, but not doing anything. Lim, I have only lost one kid because he ran away to another state. And that state JKM were not as proactive as my state. Even then I pushed all the way, but we lost that child. But everyone else we have not lost. We have no discharge against medical advice ever. For years, I have no AR discharge. We discharge with our advice. Let me give you an example about discharge. So let's say a child needs another 2-3 days IV antibiotics, but parents desperately need to go home. They have problems at home. So we say, hey, I've got an ambulatory care center. You need antibiotics twice a day. Why don't you come to the ACC twice a day? We leave the IV cannula in, okay? And you turn up there. I've got a parking slot for you, so you don't worry about parking. We create a parking slot. They turn up, get the IV antibiotics, go home very quickly. And so we settle that with parents. So we always work with parents, okay, as far as possible. We don't simply just use a Child Act. So what Lim was talking about is when the child has got a serious problem, we can always reach JKM. You must just be prepared to go up the food chain. That's all, full stop. From the district to the state to the national. I can guarantee you people will listen to you along the way.
I think dealing with parents who don't believe in treatment options for children compared to parents who have criminals because they abuse their children, we are dealing with two different. It's easier
Fully
to
agree.
speak to parents who to change their mind about the treatment. It's very easy. You just have to calm them down. You just have to speak to them over.
And sometimes I bring another parent, a parent who's got the same problem, and another parent with leukemia, another parent with some chronic disorder, and talk to them, diabetes, something, and then they understand better from talking to another parent. So there are many options for us. Jahi said, a 17-year-old child came to ED for other complaints, but instantly found to be pregnant, requested not to disclose her parents. Should we respect her autonomy? Jahi, we have no such protection for us. Zero. There's no law protecting us. This is a minor under our law. We have to inform parents. So, Jahi, what I usually would do is get the pediatrician involved. We work very differently from you. If it's an adolescent pediatrician, even better. In the team that I work in, I had adolescent pediatrician, but usually she and I took most of this because I was very interested in this. What I usually would do is I would become the child's advocate. I would make sure I know where she had sex with, and most likely this is with a friend. Okay, I'm not talking here adult. If there's an adult, we're going to fix that adult who took advantage of the child. So let's say she had sex with a classmate or another boyfriend of hers. So then I will be her advocate. I will protect her. I'll get her in hospital. I will work with her parents. They will be angry, but I won't let them torture their child. I will bring both parents in. We have a sit-down meeting with both parents and plan what to do with the future. We still inform JKM. We still inform police, but I will personally tell JKM police, don't pursue anything here. We are working with these parents to work out what to happen. So sometimes put up the child for adoption. Sometimes they decide to get married. Sometimes they carry on with their lives, go back to university, and the parents decide to look after the child. So there are many options there. I also know the NGOs in the city who can put up this teenager. If the parents are furious, I have one center in Perak where the child can go and get safety from the parents as well, authorized by JKM as well.
Okay. Can I just expand on that 17-year-old?
Yep.
Because this is a real life situation where somebody has adopted a 17-year-old child. So this 17 years old became pregnant, and about 2 months before her SPM, okay, she was about 7 months pregnant, and only then did the parents find out. and then she had sex with one of her classmates or something like that. Now, what they did was they then arranged for her child to be adopted. They then had induced her before the SPM 2 months, so her child was actually premature. Okay, and so does she have any rights to her child?
First of all, I think the induction is illegal. None of us can go into an induction at that stage for a child, you know, and we should have brought the child to term. I would have protected this girl from her peers, maybe cook up a story that she's medically unwell, found her a safe place to stay, bring the child to term, get her to sit the SPM exam wherever she is, arranged with the education department, can easily be done. Okay, so I think your question was, Betty?
My question is, okay, what right does this child has on her child?
She doesn't have at that point. It's very sad. Until she's 18, she doesn't have.
She doesn't have any right on her
No,
child.
the parents would have the right to decide for her what happens to their child, which I think is very sad, which is why I told you, Betty, we need to work on adolescent rights seriously. Huh? And when I talk adolescent rights, I'm not talking 16 or 14, I'm talking 12, you know, probably by 10. Can you imagine in the penal code, a 10-year-old can go to jail? A 10-year-old can go to jail. I think it's ridiculous. Huh? Under the Child Act, that's not possible. So we need to, you know, fix our legislation.
Yeah. Jail. A 10-year-old can make decision about his or her rights.
Yes, a 12-year-old can make a lot of decisions as well. So I think that's what the UK recognizes. UK doesn't set any age for the minimum age for a child's understanding of rights. Huh? Okay, but the UK rights also have got a side to it. Huh? You can refuse something that's not essential, but you cannot refuse something that's life-threatening. So let's say you need a blood transfusion, you cannot refuse a life-threatening, illness which requires a blood transfusion as a teenager. But you can refuse something that you can choose variable options. You can make a lot of decisions. You can choose to have oral contraceptives on your own. You don't have to tell your parents, that kind of stuff. But you know, life-threatening cannot.
So in this state, let's say Jehovah's Witness, okay, the child would be Jehovah's Witness, right?
Won't be covered. The Child Act would cover that and
will cover that,
yeah,
right?
We'll cover and move on. We do have some problem with the Tafe school, the religious school. JKM is very anxious to enter them, you know, but I just tell JKM, there's only one law in our country for children, and that's the Child Act, and we just follow that. Huh? But we still struggle with that area, Betty. That's one area that I'm still trying to work on for us to move forward. Another area that's not covered is in utero. You know, just now I said that, you know, it's illegal to induce a child. I would think that that's the penal code rather than the Child Act. But I had one lady who came in Osful, not bearing down, but Osful to the ONG department. And then she changed her mind, decided not to deliver and went home. And the obstetric team didn't call me. I was very disappointed, they didn't call me. They let her go home. She came back a day or plus later, fortunately uterus hadn't ruptured and the baby was dead. What would I have done? The Child Act doesn't cover her, I know, but I would have called my psychiatrist and said, this woman is mentally unwell. To be Osful and then to want to go home and not deliver her baby means you're not in touch with reality. And we would have used the Mental Act to enable a delivery of this baby and save that baby's life. It should be actually called infanticide for her to have killed her baby in utero by her actions. So there's some areas the Child Act are not covering, and we're trying to grow the Child Act to cover this kind of areas if we can.
So are you saying that the Islamic school, the religious school, the Child Act doesn't cover? It
covers, but you see, our welfare officers are not social workers. They don't know the act as well as some of us who read the act inside out do, you know. And religious people can be quite authoritative.
Yes.
And, you know, so, you know, in our country also, you know, girls can get married very young. Even boys can get married very young, even though none of us support it. Huh? So we need to drop the two legal tracks in our country and move to one legal track, you know. But definitely the Sharia courts haven't got any say over this. The Child Act has got all the say here, but we need to empower our our welfare officers. Sometimes they are disempowered just because they also may be from the same religion sometimes.
Yes. Okay, I'm going to stop recording.